Hello, in today's video I am going to explain what a urinary catheter is. The urinary catheter is about 50 centimeters long and is a tool that we use in urology to get urine out of the bladder. It is made of plastic, soft plastic. This part of the urinary catheter goes into the urinary bladder, this part stays out. This is where the urine bag is attached. At the same time, the urinary catheter has two parts. From here the balloon of the urinary catheter is inflated. While inflating the balloon of the urinary catheter, we proceed as follows. We install it here, and as you can see, it inflates here when you fill it with air from here. This is how it happens. The urinary catheter we see is a two-way urinary catheter. Three-way urinary catheters are also available. We routinely use this urinary catheter in bedridden patients, patients who have undergone prolonged surgery, or patients who are unable to urinate or have obstruction. The most important thing about the urinary catheter is this, let me show you. We inflate the bladder of the urinary catheter so that the urinary catheter stays in, and does not come out of the bladder. If you think it's in the bladder, sometimes patients unconsciously or suddenly pull the urinary catheter this way. When it is pulled, the balloon naturally comes out of the urinary tract by cutting or traumatizing the urinary tract as it comes out. In these patients, we may see a urethral stricture later. They need to be operated on again due to the urethral stricture, or sometimes there may be irritation of the urinary tract and the catheter is inserted. Then again, patients may develop urethral stricture. There are also long-term urinary catheters. They are made of silicone, plastic silicone. The urinary catheter that you see is Nelaton urinary catheter. These are usually done in this way. At the entrance, it says how many digits wide the mouthpiece is, so how far the balloon can be inflated, as I said. Stay tuned for your questions and suggestions.